me the cardiac enzymes on bed 1, stat. It's been over an hour already. God damn it.
Hey, doctor, admission. Why do you want me to admit bed 5?
What? Bed 5? Remind me?
That young 30-year-old male with heartburn?
Oh, that guy. Wait, heartburn? I thought he had chest pains.
Well, he has heartburn.
Are you sure?
He ate chipotle before coming to the hospital with extra hot sauce and salsa, and he's feeling a lot better after receiving some antacids. So I would really like you to send him home, please.
You never told me he had heartburn.
It's because you barely talked to him.
Where does it hurt? Where does it hurt? Where does it hurt? Here. Okay, let's get a chest x-ray, serial EKG, and cardiac enzymes. Go ahead and throw a nitro and an aspirin in his mouth. Okay, also let's do a CT chest with or without contrast. We want to make sure it's not a dissection of the aorta or you know what? Let's just do everything. I need everything. Everything stat. Okay. Stat. You see how busy we are over here? It's like a fish market in Chinatown here.
But at least ask the basics.
What's the use of that?
What do you mean?
I was gonna admit him anyway. The administration gives me special instructions to admit as many people as possible. And you know why, right? If you didn't know before, you're gonna learn now. Being an ER physician is not easy. You gotta take shit from everyone. You gotta take shit from the doctors. You gotta take shit from the patients, from the nurses, from everybody, man. The radiologists, even a piece of shit like you. Gotta take shit from shit. Ain't that some shit?
But this is a young guy with no risk factors other than eating chipotle. How are you going to justify this admission?
The biggest risk factor here is this guy.
This asshole is everywhere.
Look, I did think it could be just, a heartburn in the young guy with no risk factors. But this guy clouds my judgment. Give me a chest x-ray, serial EKG, and cardiac enzymes. Why don't you throw aspirin and a nitro in his mouth?
It could be a heart attack. It could be a lung clot. It could be a dissection of his aorta.
So I had to admit him.
But we are supposed to use our clinical judgment. That's why we went to the medical school for, right? What happened to evidence-based medicine, man?
We only practice save my ass medicine around here, and everybody knows it. I tried to use my clinical judgment once, and now that shows up as a lawsuit on my resume. They don't understand medicine. They think it's all black or white. They don't see all the grays in between. Just waiting for one little mistake, and then BAM! Lawsuit. Lawsuit. Lawsuit.
But all this workup is going to cost this poor patient thousands and thousands of dollars.
If you feel so bad, you know what? Go ahead. Discharge him. That's fine. Discharge him. But you're taking responsibility, and you gotta talk to him.
I think I'll admit him.
You never know. Chipotle could be clogging those blood vessels.
Yeah, you're absolutely right. I never thought about it. And may even get a heart angiogram as well.
Now you're learning. Welcome to American healthcare.
It's always nice to know that with heartburn, Chipotle is not blocking your heart vessels. I guess that's why it's called heartburn. It's just that it can cost $20,000.
According to an article published by the American Academy of the Orthopedic Surgeon, defensive medicine can cost between 5 and 34%. That's 54 to $650 billion annually. 90% of doctors do it. 43% of it is just unnecessary image testing, all because of the threat of a lawsuit. There's minimal evidence suggesting that malpractice lawsuits have any positive effect on American healthcare. You can have the best care and still end up in a lawsuit, or the worst care and everybody gets away with it.